And first at 5, the state's handling of the COVID-19 pandemic. WRTV is working to get your questions answered when it comes to the measures in place to mitigate coronavirus.
Yeah, we asked you to engage with us yesterday by sending us questions you'd like Governor Holcomb to answer directly. WRTV's Megan Sanctorum took your questions to state leaders.
This is the post on our Facebook page asking you what you want answered when it comes to COVID-19. This after Governor Holcomb shortened his COVID-19 press briefing and didn't take questions from reporters after, like he has in the past. Instead, he made himself available at a U.S. Department of Commerce event downtown. So today, we're working to get your questions from social media answered. Evelyn wrote on our Facebook page, Governor, why did you open everything up when our numbers are trending up? People were asking if there's a chance Indiana could go back to stage 4. In response, his office directed us to an audio recording from yesterday's event. Holcomb said during it,
we're in a much different place today than we were back in February, March at the outset. And so in terms of our capacities, in terms of our testing, in terms of our tracing, in terms of getting the word out, being able to care for those who are truly in need. But obviously you take this day by day.
Our moving average of new positive cases this week in Indiana remains over 1,100. The current positivity rate is 5.1%. Kelsey asked, do you think schools will be shut down again? And others asked if there would be statewide mandates. His office responded by saying local governments will still be able to make the best decisions for their community and impose more restrictive guidelines than the state has. When we asked if there was a plan in place in case numbers and hospitalizations continue to rise, and when we asked for clarification on what hunkered down meant, we were directed to the Indiana State Department of Health. Working for you, Megan Sanctorum, WRTV.
Well, the State Department of Health responded to those questions by saying in part that Hoosiers need to continue to wear masks and practice social distancing. They also need to stay home if they're sick and consider their own health risk factors. We sent a few follow-up questions to the governor's office as well, including, could the mask mandate be extended? Could the state potentially go back in stages by adding additional closures and restrictions? Will schools' decisions to continue to be made at the local level? A spokeswoman responded by saying the governor will continue to monitor data and listen to the guidance of medical experts. If you have a question you'd like to ask the governor or state health officials, email us at workingforyou@wrtv.com.